everyone, thanks for joining. We're going to get started now. 30 minutes, one question, one follow-up, and we have Dr. Williams and Dr. Yaffe here today, so I'll turn it over to them for some brief remarks.
Yes, good afternoon. And it's Monday, of course, so we're talking about what happened over the last weekend and with our different points and data, so I'll do that. And then Dr. Yaffe will have some comments to make about social circles and Thanksgiving. So today we had 653 new cases on Saturday and 566 cases on Sunday. And today we have 615 new cases. So we have this clustering in around the 600, mid 600 range for the last number of days. And most of these cases, as we've noted before, are in the areas of Toronto, Peel, and Ottawa, with some other contributions, say, from York Region, but extensively mostly those three. And again, while there tends to be young people that have been getting most of the case reports, we are seeing an uptick in other age groups, including some among our over 60s, 70s, and 80s. And as reported last week in our technical briefing by Dr. Brown, that is a concerning early indicator that needs to be observed. At the same time, there's concern about workplaces, people not being vigilant about staying home when they're sick, not wearing masks in closed settings, and we put out those new rules about masking in all settings throughout Ontario. So we've seen some laxity in that area, as well as people not using proper hand hygiene and not staying home if they're ill and getting tested if and when they need to under direction. And we're concerned about the number of positive contacts per case. And that's been a bit surprising because with all our measures in place, we'll announce on the 19th, the 25th, and later last week, is that we still get some people saying, well, yes, in the last number of days, 6 or 7, I think I've had somewhere between 200 to 300 contacts. That's surprising and perplexing. As if you did your proper methods of social distancing, you shouldn't have that many to talk about. That's why we're asking you to do all that and to follow that so that when public health is trying to follow up, they don't have to follow 200, 300, 400, 500 people. They should be able to contact the others in a timely way and quickly and give them information. But as a result, some places like Toronto Public Health are overwhelmed with the amount of contacts per case. And I think as a collective, we can bring that down if we honor all the other things we put in there. And so I'd be very surprised why you would have 200 to 300 contacts in the previous 7 or 8 days. Then you're obviously not following any of the public health measures we've recommended. So it helps us. It helps places like Toronto Public Health to get back to doing the kind of contact tracing they need to have, and helps our laboratory system as well as the testing systems and other ones that we're trying to bring into control and deal with that aspect there. At the same time, we're looking at our outbreaks and where they're occurring. And we're seeing a number of workplace outbreaks. We're still seeing some of our cases in our long-term care facilities. But a number of those outbreaks in the long-term care facilities are, fortunately, one case, maybe 2 cases, and they're getting on them fairly quickly. We do have some concerning ones, and the IMS team, is working on that to bring those under control and deal with that. Especially true in the Ottawa area, but we're having some impacts in the Toronto area as well. And we have other outbreaks, as I said, in some workplaces. Our school ones are going, a lot of work is going on there. You've heard some announcements by the minister today with even more resources being added to deal with that and to monitor them very quickly. A number of the school ones deal with 1 or 2, either staff or students. And the public health departments, along with the administration, the principals, are moving quickly to put in place different methods of quarantine and closing classes or holding and assessing that and trying to contain that as quickly as possible. There are some schools that have closed. There are some schools that have opened again. So this is all part of the dynamic as we deal with it. Again, if we had low case counts in the community writ large, it's less of an issue with the schools also. So we need to keep that in mind as we go forward. How are we doing on this overall one? As you heard from Dr. Brown last week, if we continue as we have in the days prior to our technical briefing, where we already were at 700 back on the 28th of September, we would be doubling that number within 10 to 12 days. That means that in a few days, we should be at 14 or 1,500 in a day. We're not there. That's probably good news. We're, as I said, holding around the mid-600s. I said before, if we did what we're supposed to do, and we put in place what we asked on the 19th, the 25th, and this past week of measures to try and contain that, we can, as we did on the first wave, flatten this curve and bring it down. I'm hoping that this method right now, we're going to start to see some plateauing of these numbers as we had over the last number of days. Let's see if we can continue to do that and bring it down and not have the doubling as predicted by the modelers and even by Toronto Public Health in that matter. So overall, we're not doing as well as we should. We need to really tighten up on the social contacts, and Dr. Yaffe is going to talk about that. We need to be especially careful around events and activities, and Dr. Yaffe will give some more discussion on that with ones coming up. And we need people to do what they need to do it and do it again and do it well, especially in this time when we're trying to flatten this curve back down again, so that any sort of curtailment in activities, we can bring that back down and ease off it again if we get the numbers back down again. And I think it's within our powers as Ontario citizens to do that. We did it before, we can do it again. You know what to do. We know that you know, so let's just do it together and do this successfully. So with that, I'm going to hand things over to Dr. Yaffe to talk about other aspects related to social circles and other special events.
Okay, thank very much, Dr. Williams, and good afternoon, everyone. So, as Dr. Williams has said, our public health units are reporting ongoing challenges with increasing number of contacts per case, much higher than we saw in the first wave, and more interrelated outbreaks across multiple settings and facilities, which is leading to more complexity in our case and contact management. And it's because of these factors we're now asking people to avoid close contact with people outside of your household, even when you're celebrating or recognizing occasions when you would normally gather with others. In other words, your close contacts should be limited to those people who you live with. Recognizing the impact this will have on those who live alone, we're advising if you live alone, you may consider having exclusive close contact with another household that you trust. This can help prevent feelings of isolation and mitigate potential negative mental health impacts. So what does this mean for the upcoming Thanksgiving weekend? We're asking that people limit their celebrations to those they live with and consider hosting a virtual gathering with anyone outside their household. How this pandemic will continue to unfold is in our hands. It's in your hands. And it's up to all of us to reduce the transmission of COVID-19 and keep each other healthy and safe. Thank you.
Just a reminder, one question, one follow-up. Over to the first question, please.
From Randy Rath at CHCH TV. Please go ahead.
Hi, doctors. I'm wondering if you could tell me what therapeutics are used to treat COVID in Ontario. Is it the same stuff that was used, the remdesivir and the dexamethasone that was used to treat President Trump?
In our discussions with our clinical group, they have used those same medications. In that, they are continually looking at different forms, reviewing the literature, moving from ideas around mandatory ventilators to other assistive methods. So a lot has been learned through the first wave. And we did have a presentation back a couple weeks ago by our clinical specialist group, especially those dealing with ICU and complicated cases. And so the question you've asked, have they been using those? Yes, they have. Are there other ones they're looking at? They're looking at different ideas and different strategies as the evidence and the science reviews come in and as they critically review those and look at those. So we continually, I'm continuing to be impressed by the work of our specialists, especially the intensivists, who are doing a terrific job at monitoring all these and making sure that anyone who does get to the intensive care unit gets the best, most up-to-date care as they see as evidence-based and supported. So yes, they have followed some of those methods in there, and whatever we are learning from what the President of the USA is getting, we're already doing a number of those things at this time.
Follow-up?
Also about Mr. Sorry? Okay, also about Mr. Trump, he's tweeting that people shouldn't be afraid of COVID and that people shouldn't let it dominate their lives. Is he really offside with this?
Well, I would say that the President of the United States has been tweeting a number of his comments. He does that. Dr. Fauci has some other comments he makes. I think the science is complex in the States. The number of cases is concerning deaths are concerning. So for some people, as we say, some younger people, it may seem to be fairly mild at this stage. For people who are vulnerable, with those with high-risk comorbidities, age, and other factors, it has been, as our data shows you already, in fact, quite impactful to the level of severe illness and prolonged hospitalization, unfortunately, a number of deaths as well. So I can't agree that across the board it's not a big issue. It is a big issue for some. And I think I don't really know the science yet about young people contracting COVID and what the long-range consequences, sequelae is a word we use in medicine, may be, because we're still learning about it. And already there's been some reports on that. So I think we have to be very cautious about making any wide sweeping comments in that until we're advised better by our scientists and by the different evidence we're seeing. And our evidence tells us that for some sectors of our population, it is very concerning and very harmful. So we continue to do that messaging, as Dr. Yaffe has alluded to tighten that up, especially now we're asking our over 70-year-olds to be very careful with their contacts and exposures, especially during special events such as Thanksgiving coming up. So we're very concerned about that.
Next question.
From Colin DeMello at CTV News.
Hi, good afternoon, doctors. Earlier today, the Premier had talked about needing hard evidence before introducing new restrictions in terms of closures. And a lot of the public health units are saying, well, you guys have access to all kinds of data and information on a daily basis that should help you make those decisions. Can you provide me a list of some of the specific hard evidence that you guys are either looking for from local public health units or rely on when making a decision in terms of closing a particular part of the economy or introducing new restrictions?
Since I was at the press conference where the Premier was asked that question, I think in where we were asked by some health units to carry out certain closures to our public health measures table, they went to the public health data and asked for evidence of outbreaks related to large settings such as banquet halls and meeting places, and there was reported outbreaks related to those settings. Before we had the outbreaks related to backyard gatherings, and we took steps and put measures to deal with that. We were also made a concern that there's outbreaks related to some late night bar and activities around that, nightclubs and certain ones, strip clubs, etc. And so we took that evidence and we put in steps and put them in place to deal with that. I think what the Premier is asking is that if you're going to come and ask for even more, we need to have at our public health measure table and then moved on up to their cabinet for a decision, what is the evidence if there's a new sector that needs to be closed or constrained, what's the data that would support that that is a current source of infection and problems at this time. And so I think he was more referring at the press conference to, for example, like closing all the bars and restaurants to indoor dining in Toronto. And he was looking for more of the evidence that patrons who had been frequenting those institutions had been impacted with illness. And as of yet, we hadn't seen that. We have seen outbreaks related to staff during their pre- and post-work time and their activities in the back rooms. So there was concerns about ongoing inspections related with Ministry of Labor and to ensure that adherence to those standards was being maintained. But as of yet, we hadn't received specific data related to outbreaks in these various restaurants that have been asked to undertake, as we put in our record last week, to limit to less than 100, and the distancing of the 6 feet between patrons, as well as only 6 to a table if they knew that setting, and well as limiting lineups to make sure that people are within 6-foot distancing, masking, disposal menus, a whole bunch of things that they put in place. And so I think the Premier is concerned that a number of them have put investments into protecting their patrons, and so far he was not convinced, and we have not given it to him yet from our table because we have not received it from the health units, that these establishments writ large are contributing to outbreaks in the community. So it's that kind of data that the Premier is looking for. We're looking for because by doing some of these steps, there are consequences. And when you're closing down places, you may be taking away people's form of income. They may have to look at permanent closure if they can't maintain their status. So there are consequences if you do it without enough evidence. But as the Premier said, if there's evidence, he has no problem with closing them down. But he would like to have the data to support that.
Follow-up?
Okay, perfect. And this afternoon, the Centers for Disease Control in the United States, they updated their guidelines for the coronavirus. They said that now it is able to be, the airborne transmission is possible and it can be spread with somebody who's further than 6 feet away. I'm just wondering if you guys have seen that guidance and your thoughts on that.
Dr. Yaffe?
Yeah, I actually haven't seen today's information from CDC. I'll look it up. But we work very closely with Public Health Ontario, and they are always looking at the most up-to-date evidence, and I'm sure they'll be looking at that as well. We know that the major and most important transmission mode is contact and droplet. If it were widely airborne spread, we would have much bigger explosive outbreaks. That's not to say it's not possible to have airborne, and we'll certainly be looking at that data.
Next question
is from Rob Ferguson at the Toronto Star. Please go ahead.
Hi, doctor. So I just want to confirm, you're pretty much saying the social circle is dead.
I guess we're saying the social circle at this point is not relevant. It was relevant as we go along. This outbreak is changing. We're learning. It's evolving. And given the current picture, we're saying stick to your household. That's what we're saying at this point.
follow up.
At what level would you? At what level of daily cases would you bring back the social circle? What numbers would we have to be below?
Well, right now, where we've had the difficulty is that at the end of the summer, early September, people became fairly liberal on their application of the social circle and had many circles and different ones, including the fact now many of them have their children in school cohorts as well. So it's gotten more complicated. The school one will continue, of course, as we want to endeavor to keep the schools open because of the health consequences that we have been informed upon to do so. I think if we get numbers back down, and then can people, I guess, having learned from the experience of being too casual about that with large backyard gatherings and groups and things, as I said before, if our social circles were intact, I'd be surprised to ask someone saying, oh, you have a positive case. Who are the other 9? There should be no more than 9 or 10 or 11 contacts. I'm very perplexed to see people say, well, 50, 100, 200, 300. What is going on? So obviously people had not applied it very carefully. And we've seen events at the in London with the university students and younger people where there was a lack of adherence to that. So we'd have to get the numbers down a lot again to see if we would want to invest back in that. And as Dr. Yaffe's alluded to, it's an evolving situation. And we will address that if and when the numbers and the R naught or different numbers indicate that we can be more open to that in the future. But right now we've got a wave to flatten.
Next question
is from Heather Wright at The Independent. Please go ahead.
Good afternoon, doctors. I wondered if you could clarify some of the rules around long-term care visitation. Is it mandatory for homes to allow essential caregivers in, even in outbreaks, or can long-term care homes make their own rules and close the doors to them?
Well, if there's an outbreak in a long-term care facility, that would be declared by the local public health unit. The local health unit would work very closely with the facility to determine whether essential caregivers should be allowed. It would depend if the outbreak is perhaps on one unit, or is it in multiple units? Is it just one staff person, or what? Again, it would depend. If it's a widespread outbreak, probably they would not be allowing essential caregivers, or very few of them. But again, if it's just in one unit, that may be a limitation to one essential caregiver per person. It would have to be worked out with the local public health unit.
follow up.
Yes, just to be clear then, it's not the homes that make the decision, but public health?
That is correct. In an outbreak situation, it would be the local health unit.
Next question, and this will be the last question,
is from Jeff Gray at the Globe and Mail. Please go ahead.
Oh, hi. Thanks. Thanks, doctors. I wanted to ask, I guess, back to this issue of the evidence that the Premier was referring to. From Toronto's point of view, they've said that the number of cases they have has outstripped their ability to do contact tracing properly, and hospitals, right, have warned us that things are not looking good. We're not past the time when we need to argue about the evidence and something more dramatic needs to be done, if that's what the local officer of health is requesting?
So we had discussions before the weekend, and I've had more discussions today again with in Toronto with Dr. Davila, and we've talked about these areas of concerns, how they're trying to struggle with the amount of case contact load with their staffing. We had initiated some discussions with their teams. We've moved in and made some obligations to give more staff supporting to them, as well as to Ottawa, because we've been talking with Dr. Etches, who has similar concerns in her respective jurisdiction. So we're trying to move alongside to help with the case contact management with the workload. At the same time, looking at how best to bring down the numbers in there, as we're not yet seeing the full impact yet of the measures we put in place, because it takes a good 7 to 10 days after we put the announcement out for it to start to show in our data. We have the ongoing issues there with the assessment sites and their changes, so there's a lot of things moving at the same time. And I know Dr. Davila has concerns about just how do you bring down the numbers and to control it in there. So we're having regular discussions. We'll continue to review that. We're continuing to look at the data to find support and evidence if there's specific targeted interventions that could, or should be undertaken that would show that they're a source or key aspect donating to these large numbers of outbreaks of cases. We would want to move on those. So we continue to look for that advice and direction while supporting both Toronto and Ottawa and Peel if needed as they deal with this wave at this time, really impacting their specific jurisdictions. Some other ones around Toronto have some increase in numbers too, but some parts of the province are very quiet at this time, and we'd like them to remain that way. So we have a varied response in various areas, trying to work with each local medical officer of health to bring in what they feel is necessary if and when their data supports that. So the conversation has and will continue as we seek to work with them in partnership and collaboration to deal with the issues in Ottawa, Toronto, and Peel, and some of the others around the GTA.
Follow up, and this will be the last question.
Oh, thanks for that. And just with regard to the testing issues and the changes now, there's some experts who sort of say, look, without, given the way things were going last week, and now we don't have a clear view of testing results. We focus on those numbers, that top line number. Are we flying blind somewhat this week to not know really what's happening with the spread of this thing?
So I think if you look at the numbers, back in wave one, thought we were doing great with 10,000 to 12,000 a day. Now with our current backlog in that, we're down to 39 to 41, 42,000 each day. That's not actually flying blind. I think what they want to know is about, especially in Toronto, the case contact and some of the announcements they were making on that. They have still said they're going to be really focusing on high-risk priority areas. So it's not that they're not going to follow those. They are going to follow those and still contact every case that's identified in lab testing. So that has not dropped back. And the backlog of the lab testing has already dropped. We're trying to do some more processes to bring that back down under control. And so we hope to get the backlog taken place, but still doing well close to 40 and above 40,000 tests a day in the province of Ontario. As the Premier keeps saying, that's more than the rest of the country combined. And that's true. So I can't say that's flying blind. Is it as timely and as robust as we'd like it? We'd like 24 to 48 hours in a turnaround time with our critical lab tests. We'd like to get back to that. And so that's just as important as the volume of tests. We want to tell people who need it that they get the answer back in a reasonable timeline so they can respond, especially those that are of critical importance that even Toronto is not going to drop and leave off, because they have identified those as priority ones that they will continue to work on until we rectify the work situation, as well as the testing, as well as the other lab issues that need to be addressed when we're doing such large numbers.
Thanks, everyone.